Electric shocks can vary in severity, from minor tingling sensations to life-threatening situations. It's important to remember that you should always prioritize your safety and the safety of others when dealing with electrical incidents. Here's a step-by-step guide for providing first aid treatment for electric shocks. Ensure safety. Before attempting to help the injured person, make sure the area is safe. If the person is still in contact with the electrical source, do not touch them directly as you could become a secondary victim. Turn off the power source or remove the person from the source using a non-conductive object such as a wooden stick, plastic, or a cloth. Call for help. Dial emergency services immediately or ask someone nearby to do it for you. If the person is unresponsive, not breathing, or severely injured, call for an ambulance or emergency medical help right away. Check for responsiveness. Gently tap the person and speak loudly to check if they are responsive. If they are not responding and not breathing or having difficulty breathing, you may need to perform cardiopulmonary resuscitation, CPR, if you are trained to do so. Keep the person lying down. If the person is conscious and breathing, keep them lying down in a comfortable position. Do not move them unless it's absolutely necessary to avoid aggravating any potential injuries. Inspect for injuries. Once the person is safe and responsive, carefully inspect them for injuries. Electrical shocks can cause burns, fractures, and other internal injuries. If you notice any burns, do not break any blisters that may have formed, as they act as a natural barrier against infection. Cover burns with a sterile dressing. If there are any burns, loosely cover them with a clean, non-stick sterile dressing or cloth. Avoid using adhesive bandages directly on the burns. Elevate the legs. If the person is stable and not showing signs of a head, neck, or spinal injury, you can elevate their legs slightly to help maintain blood flow to vital organs. Keep the person warm. Electric shock can cause the body temperature to drop. Cover the person with a blanket or clothing to keep them warm while waiting for medical help to arrive. Do not give fluids. Refrain from giving the person anything to eat or drink. Leave this to the medical professionals, as they may need to perform tests or procedures that require an empty stomach. Stay with the person. Provide reassurance and keep a close eye on the person's condition until medical help arrives. Remember, electrical injuries can be very serious, even if they initially appear minor. Always seek medical attention after any electric shock to ensure that there are no internal or delayed complications.